Have you ever found yourself sitting on the toilet, pushing with absolutely everything you have, only to realize that nothing is happening? You know it's right there. You can feel the heavy pressure, but no matter how hard you strain, it feels like you are trying to push a solid brick through a tiny space, and it simply will not budge. You get exhausted, you give up, and you try again a few hours later or even the next day, only to face the exact same frustrating and painful reality. If you are watching this right now and nodding your head, take a deep, deep breath. You are not alone, and you are not imagining things. You are dealing with a very real, very serious physical issue, and today we are going to tackle it head on. Welcome to today's video, titled Stool Stuck in the Rectum, What is it and What to Do? What you are experiencing right now is a physical blockage. It is a rock-hard mass of stool that has essentially trapped itself inside your body. It is uncomfortable, it is scary, and honestly, it is a topic that most people are way too embarrassed to talk about. Because of that stigma, people end up suffering in absolute silence. But we are not going to be silent about it today. I am going to break down exactly what is happening inside your digestive system right now, why your usual bathroom habits aren't working anymore, and most importantly, I am going to give you a clear, step-by-step emergency action plan to safely resolve this blockage and get your body back to functioning normally. So what exactly is going on down there? In clinical terms, this condition is known as a fecal impaction. But let us strip away the complicated medical jargon for a moment. Essentially, what this means is that a large, severely dehydrated, and incredibly hard mass of stool has formed and become tightly wedged inside your rectal cavity. One of the biggest misconceptions about this kind of blockage is that it just happens out of nowhere. You might be sitting there thinking that you felt totally fine yesterday, so why is this happening today? But the reality of human digestion is that a mass like this never forms overnight. It is actually the climax of a slow buildup. Usually this situation develops over 3, 4, 5, or even 7 days of incomplete digestion. What often happens is that you might still be having what you think are regular bowel movements, but you are not actually emptying completely. You go to the bathroom, pass a small amount, and feel like you are done, but a portion of waste is left behind. Day after day, that leftover stool accumulates. Now remember that the primary job of your large intestine is to absorb water. The longer that waste sits inside your body, the more water is continuously drained out of it. By day 5 or 6, it has lost all its moisture. It transforms from a normal, soft consistency into something that physically resembles a dry, heavy stone. Think of it like trying to force a solid, jagged rock through a small, narrow rubber pipe. That pipe is designed to stretch and move soft, pliable materials. But when it is faced with a solid rock, the pipe just stretches to its maximum capacity and gets stuck. The rock will not compress, and the opening cannot expand any further. That is exactly what is happening inside your lower digestive tract right now. No matter how much downward pressure you apply by straining, the mass is simply too large and too solid to pass. In fact, pushing harder at this stage only compresses the rock further, making the blockage even more painful and difficult to move. Now that we understand the mechanics of this blockage, we need to enter what I call the danger zone. You need to understand that a fecal impaction is not just a frustrating inconvenience. It is a genuine medical emergency that sends a ripple effect throughout your entire pelvic region. And the tricky part? It often disguises itself with very confusing symptoms that might lead you to treat the wrong problem. For example, one of the biggest red flags is something called overflow diarrhea. You might experience watery, liquid stool suddenly leaking out, leading you to believe that you definitely do not have a blockage. You might even think you have a stomach bug and consider taking an over-the-counter anti-diarrheal medication. Please do not do that. What is actually happening is that the rock-hard mass is completely blocking the exit, but the new liquid waste coming down from higher up in your digestive tract is squeezing and seeping around the edges of that solid stone. If you take medication to stop diarrhea, you will only paralyze your digestive tract further, making the rock-hard impaction much, much worse. Another hidden symptom that catches people completely off guard involves your bladder. You might suddenly find it incredibly difficult to pee, or you might feel the constant, urgent need to urinate, but only manage to pass a few painful drops. Why does this happen? It all comes down to basic human anatomy. Your rectum and your bladder sit right next to each other in a very confined space inside your pelvis. When your rectum is distended to its absolute limit with a giant rock-hard mass, it physically bulges out and compresses the bladder in front of it. The pressure can be agonizing. In severe cases, people end up in the emergency room needing a urinary catheter simply because the stool blockage has forcefully pinched the bladder shut. But the dangers go far beyond a compressed bladder. If you ignore this blockage, or if you just keep aggressively pushing and straining hoping for a miracle, the consequences can be devastating. Your intestinal wall is a muscle. When it is stretched beyond its capacity for days on end by a hard, dehydrated mass, the blood supply to that living tissue gets severely compromised. This can quickly escalate into a complete intestinal obstruction. In the absolute worst-case scenario, the extreme internal pressure and friction can cause a bowel perforation, which is a physical tear in your intestinal wall. If that happens, toxic waste spills directly into your abdominal cavity, leading to a massive, life-threatening infection. This is exactly why you cannot just wait for this to pass on its own. When you realize you are dealing with a severe blockage, the very first thing you must do is stop straining, stop pushing. You are only going to hurt your internal tissue and cause severe swelling. Instead, we are going to follow a very specific 4-step emergency action plan. Step number 1 is your first at-home intervention. You need to go to the pharmacy and get a box of adult glycerin suppositories. Now here is the crucial detail that almost everyone gets wrong. You are not going to use just one. For a hardened blockage of this magnitude in an adult, you need to use 3 adult glycerin suppositories at the exact same time. Here is exactly how you do it. First, you need to lie down on your side. This takes the downward gravity and pressure off your pelvis. Next, you must lubricate the suppositories. Even if they feel slightly slick out of the package, apply a generous amount of a safe, water-based personal lubricant. Remember, the mass inside you is bone dry, and introducing anything without heavy lubrication is going to be painful and difficult. Gently but firmly push all 3 suppositories deep into the rectum, right up against or alongside that hardened mass. Now comes the absolute most important rule of this entire protocol. You must wait. The biggest mistake people make is inserting a suppository and then immediately running to the toilet the second they feel a slight urge. Do not do that. You must hold it in and stay lying down on your side for a minimum of 30 minutes. The glycerin needs time to physically melt at your body's temperature, coat the rock-hard stool, and intensely lubricate the surrounding internal walls. If you rush to the toilet after 5 minutes, you will just push out the unmelted suppository, and the rock will stay exactly where it is. Give the process time to work. Now, what happens if 30 minutes pass, you go to the bathroom, and the mass still will not budge? Do not panic. We move to step 2. You are going to get up, walk around a little bit, and wait for about an hour. Give your body a brief rest. After that hour has passed, you are going to repeat the exact same process. Lie back down on your side, heavily lubricate 3 more adult glycerin suppositories, insert them deeply, and wait another full 30 minutes. Sometimes that first round of glycerin only manages to soften the very outer layer of the blockage. This second round provides the extra volume of lubrication and stimulation needed to finally dislodge the core of the mass. If you have completed 2 full rounds of this suppository protocol and that rock is still trapped, your at-home attempts must stop immediately. Step 3 means it is time to go to the emergency room or an urgent care clinic. Do not be embarrassed. This is a true medical emergency, and the hospital staff sees this far more often than you would think. At the hospital, The medical team will perform a professional clinical-grade enema, often referred to as an intestinal lavage. They have the proper tools, the correct fluid volumes, and the expertise to safely flush water and medical lubricants higher up into the colon to break apart the mass from the inside out. But what if even the hospital enema fails? That brings us to step 4, the absolute final medical resort, manual extraction. I want to be completely honest and transparent with you about this stage. If the mass is essentially cemented inside the rectal cavity, a specialist will have to physically go in, break up the stone manually, and pull the pieces out. Because the surrounding tissue is incredibly inflamed by this point and the mass is so hard, this process is highly painful. In many cases, they will not do this while you are awake in a standard exam room. You will likely be taken into an operating room where they will provide deep sedation or even administer spinal anesthesia to numb your lower half completely. It sounds intense and it is a serious procedure, but it is the only way to safely remove the obstruction without tearing the bowel wall. Once it is successfully removed, the immediate relief you will feel is indescribable. The dangerous pressure drops instantly, the pain vanishes, and your body can finally function again. Once that emergency blockage is finally cleared, you are going to feel an overwhelming sense of relief. You will probably feel like a brand new person. But here is the hard truth that you need to hear. Removing that impaction is just winning one single battle. It does not mean you have won the war. If you go right back to your normal daily routine and maintain the exact same habits that caused your stool to dehydrate and harden in the first place, this painful nightmare is absolutely going to happen to you again. This is why we have to talk about breaking the cycle and managing your digestive health for the long term. The absolute worst thing you can do to prevent this from recurring is to rely on over-the-counter stimulant laxatives. I like to call these stimulant laxatives your false friends. Sure, they might offer you a quick fix and a temporary sense of relief today, but over time they are actively ruining your natural digestive rhythm. They work by chemically irritating and forcing your intestines to contract unnaturally. Eventually, your bowel becomes completely lazy and entirely addicted to that harsh chemical stimulation. If you try to stop taking them, your body literally forgets how to push waste out on its own, leading you right back to severe chronic constipation and yet another traumatic blockage. But what if everything we've been taught about fixing constipation is completely wrong? What if I told you there is a way to naturally restart your digestion and clear out that residual waste without relying on those harmful chemicals or even eating mountains of fiber? It makes absolutely no sense at first, but thousands of people are actually emptying their bowels twice as fast by eating no fibers at all. It all comes down to a strange 8,000-year-old underwater gut superfood. By adding just one simple pinch of this to your daily routine, you can quickly soothe your gut and drop up to 10 pounds of toxic poop that is silently clogging your intestines. It allows your body to fully eliminate that toxic buildup and achieve a light, healthy, and comfortable digestive system in just days, without restrictive diets, expensive probiotics, or medications. You have to see the science behind this to believe it. Right now, grab your phone, open your camera, and point it at the QR code flashing on the screen to watch a short, eye-opening presentation on exactly how this underwater superfood works. If you are watching this on your phone right now, don't worry. I have also put the direct link right at the top of the pinned comments below. Go check it out. Because true, long-term management is a science. It requires a proper, sustainable protocol tailored specifically to your body. This means prioritizing deep hydration because water is the only thing that keeps waste soft as it moves through your system. It involves analyzing your daily physical movement, your dietary fiber, and even physically retraining your body to use the bathroom at a consistent time every single day. To do this safely and effectively, you need professional medical guidance. Seek out a digestive health specialist who can help you build a real, long-term plan, so you never have to face this kind of terrifying emergency ever again. Please do not suffer in silence and do not let embarrassment stop you from getting the help you desperately need. If you are struggling right now, stop straining, follow the emergency protocol we just outlined, and get yourself to a doctor if the situation does not improve quickly. Your health and your comfort are far too important to ignore. If you found this information helpful, please hit the like button right now. It really helps the channel. More importantly, share this video with your family and friends. This is a topic that people are terrified to talk about, but countless people suffer from it behind closed doors. This video might just be the exact emergency guide someone you love needs right now. Don't forget to subscribe to the channel and hit the notification bell so you never miss our future content on optimizing your body and taking control of your health. Stay hydrated, listen to your body, and we will see you in the next video.